Hi, everyone. Happy Monday. Welcome back to Family in Focus on PHLV Radio, brought to you by the Asian Community Development Council. And today, as you can see at our title, we're talking about sleep. This is such an important topic for so many people out there, maybe not getting enough sleep, or it's affecting your health, or, you just kind of think, these are the things we do every day, but maybe we don't talk about it, why it's so important. And March actually has a National Sleep Awareness Week. And this is so important that people are actually talking about it and how it can contribute to good health. And to talk about the subject, we have a guest returning to our show, Dr. Maria Urbiztondo. She's actually been on before. Thank you so much for being back here with us to talk about this great topic. She is a medical doctor, but also she works as a sales agent for Humana. So Dr. Maria, welcome back. I'm going to let you take this and tell us a little bit more about the importance of good sleep.
Perfect, Patranya. Thank you so much for having us back. Humana is very privileged and proud to partner with the Asian Community Development Council. And so we are always ready and here to help and serve the Asian community. Let's roll the slides. So today we're going to talk about getting healthy sleep. What does healthy sleep look like and how can you have it? Things to remember. The things we talk about today don't replace professional health care. For medical guidance, talk to your doctor. Consult your doctor before beginning any new exercise or dietary regimen. Please put your cell phone on silent if you're with other people in the room. Let's keep our conversations to a minimum. And remember, this class is a safe zone. The information provided here is for educational purposes only. It is not to be used for medical advice, diagnosis, or treatment. So consult your doctor if you have questions or concerns. So for our agenda today, we will cover 5 topics. Number 1, why good sleep matters. Number 2, how much sleep you may need. Number 3, stages of sleep. Number 4, your common sleep challenges. And number 5, some tips for better sleep. Why good sleep matters. Good sleep is essential to good health. A lack of sleep may lead to many different things, such as difficulty thinking clearly and reacting quickly, maybe some problems with memory, an increased risk of heart disease, high blood pressure, and other medical conditions, an increased risk of depression and irritability, and even weight gain. But how much sleep do you need? The 8-hour per night recommendation does not apply to everyone. Remember, everyone's sleep needs are different. Most older adults do need between 7 to 8 hours of sleep per night. You may be in what is called a sleep debt, kind of like having a bank account, but making too many withdrawals from a lack of sleep. So taking a 2-week sleep vacation may help you get out of it and discover your true sleep needs. Now we come to the stages of sleep. You know, your brain is very active when you are asleep, but in different ways compared to when you're awake. Most people cycle through 5 stages of sleep several times throughout the night. Stage 1, when you're drowsy, it's a transition between wakefulness and sleep. Stage 2, a light sleep, where your heart rate and body temperature drop. Stage 3, a deep, slow-wave sleep, where the body repairs itself and brain waves become slow and deep. Stage 4, a deep, slow-wave sleep, there's no eye or muscle movement. And finally, stage 5, also known as REM sleep, where the brain waves speed up and dreaming occurs. So the sleep challenges as you age are threefold. 1, it may take you longer to fall asleep. This may be due to a sleep disorder like insomnia or certain lifestyle changes. Number 2, you may wake up more often. You may be woken up more easily due to loud noises or bright lights, maybe pain from a health condition, or the need to use the bathroom. And number 3, it may be more difficult to transition between wakefulness and sleepiness. You may wake up often in the middle of the night and have a harder time falling back to sleep. Here are some tips for better sleep. You want to tweak your daytime habits. What do you do during the day? The things you do during the day can have a big impact on how well you sleep at night. The following tips may help. Get enough sunlight, especially in the morning. Limit your caffeine, alcohol, and nicotine intake. Get plenty of exercise and keep your naps short, early in the day, and comfortable. You could also change your nighttime routine. Consistent nighttime rituals may also help you get better sleep. Consider making the following changes to your nighttime routine. Number 1, set a bedtime and stick to it. Number 2, create a wind down routine with relaxing activities, maybe a warm bath, a shower, reading, listening to soothing music, or meditating. Number 3, limit your use of electronics before bed. And number 4, pay attention to how much you eat and drink. You can also relax your mind. How do these relaxation techniques help? Activities that help you relax can reduce stress and help prepare your body and mind for sleep. Try different relaxation techniques. Consider meditation, deep breathing, and progressive muscle relaxation. And finally, get yourself in the right frame of mind. Try making a to-do list for the following day. You can also write down things you're grateful for. Create a good sleep setting. The ideal sleep environment is cool, dark, and quiet. Here's how to create the ideal sleep environment. Keep your room cool. For most people, that's between 65 and 72 degrees Fahrenheit. Keep your room dark with blackout curtains or wear a sleep mask and avoid bright night lights. Keep your room quiet. You could use a sound machine as well. And finally, use a comfortable mattress. So please work with your healthcare team. Your healthcare provider can help you understand why you may be having problems sleeping. Keep in mind, you may need to be tested for a sleep disorder. You could also be experiencing sleep problems due to a side effect from a medicine that you are taking. Remember, check with your doctor or pharmacist before taking any supplement or herb to help you sleep. Finally, my name is Dr. Maria Urbiztondo, sales agent for Humana. Our main office is located on Warm Springs Road, Las Vegas, Nevada. My phone number is 702-773-9277 in that red box right there. Please give me a call or email me at murbiztondo@humana.com. We at Humana can help you find the right plan to fit your needs and answer any questions about Medicare insurance.
All right, Dr. Maria, that was a great presentation. And, just for me, I feel like my biggest question is, when do I know how much I get, how much sleep do I really need, right, to function well? Because I feel like, about 7 hours, I feel well, but, people say 8 hours. So does it depend, Dr. Maria, depending on your age, or, do you need more sleep as you get older or less sleep? Well, what's been your experience dealing with your patients?
It does depend on your age, the level of activity that you do on a daily basis. And it has been shown in studies that as you age, people tend to sleep less naturally. So maybe you would need 8 hours in your 20s or 30s. You might just need 4 to 5 hours when you're 70 or 80. A good rule of thumb is as long as you feel rested and well during the day, you're not falling asleep, you're not having problems with, drowsiness or feeling tired during the daytime, your body typically knows what a good amount of sleep it needs for the evening. If you have any questions or concerns, bring them up to your doctor. Sometimes it might be, like in the presentation, due to some medication you might be taking as well. So,
and the other question I think a lot of people bring up, and I'm guilty of this, is using your phone right before bed, just having that right next to you. And I think that can really disrupt the kind of sleep you get and how easy it is to fall asleep, right?
Yes, yes. Phones, iPads, anything electronic, TVs. Actually, there's a scientific study that has said the use of TVs in the bedroom can
Mhm.
affect the number of hours of sleep you get. So I know for me personally, my husband would want that 65-inch TV in the bedroom, but I tell him, no, we're not having a TV bedroom. You can look at your iPad until you fall asleep, but the TV, just too many electronics, too much extra noise. Um,
Mhm.
the body really likes cool, dark, quiet. So you want to create that sleep environment for yourself. And isn't it nice when you have just that really great 7 or 8 hours of sleep for yourself? It's a wonderful feeling when you get up the next day.
And I feel like it makes such a difference. Like I used to be a TV news reporter in the day, and I worked the morning shift. So I would wake up at 2:30 in the morning and then go to work at 4:30. So I try to, go to bed early, but I don't always get to do that. So I remember back in the days, I would be tired all the time. And that really affects a lot in your life, like, the kind of food you eat, the things you're doing. So not having enough sleep, Dr. Maria, can really affect you in more ways than one, right?
You got it. You hit the nail on the head right there.
So we have some questions for you, Dr. Maria, that maybe you can help clarify. The first question is, people here in Las Vegas, we work all kinds of hours, right? People work overnights or, early mornings. So can you make up for that? And if you don't go to sleep at like what you say, normal sleeping time and still stay healthy?
Yes, actually, in the presentation, I talked about something called sleep debt. So I'm going to
Mhm.
elaborate on that a little bit more. So you can think of your sleep as a bank where when you're getting enough sleep, you're making deposits into your sleep bank account. And so
Mhm.
as long as that sleep bank account is filled, you're going to be a happy camper. Now, people who work night shifts, they work very erratic schedules. Maybe they're not getting enough sleep. Maybe doctors and nurses, they're only getting like 2 to 3 hours of sleep. They are slowly starting to make withdrawals from that sleep bank. And so over time, your sleep bank account is going to get depleted and you will not have as much hours or money in that account as you used to. So, really, what you have to do for yourself is set aside some time, maybe a weekend, maybe a couple days. All you do is you go to sleep when your body feels tired
Mhm.
and you don't set an alarm. You wake up when your body is ready to wake up. Now, this can be hard for some people because they have obligations, they have families, they got to go to their job. They just don't have the 24, 48 hours of being able to sleep. But I tell you what, it works because I use it myself as
Mhm.
somebody who, used to practice medicine. And now I do have times where I get up maybe 5 o'clock, 6 o'clock in the morning. I'm up all day. I'm doing things until maybe 9, 10, 11 at night. I'm not getting my 7 or 8 hours of sleep. So on the weekends, I literally will just start sleeping at 1 p.m. I don't get up until 6 or 7 that evening. I have dinner and then I'll go fall asleep again like at 9 or 10 at night. And it kind of resets my cycle so
Mhm.
that your sleep bank account is full again. And then, you might be asking, well, is this a permanent thing? No, it's not permanent. When you start depleting that bank account again, that's when you're going to have to do that exercise where you make deposits into your sleep bank account again, take
Yeah.
another weekend, go to sleep, fill it up, and there you are.
That's interesting. All right. Another question that we have for you is when do you know that sleeping has become such a problem that you do need to see a doctor? What kind of things can you start noticing about yourself that you need medical help?
Well, in medicine, typically when it starts to hinder your daily activities, when you feel like you are not yourself in the daytime, maybe some people they fall asleep at the wheel while driving. People just keep finding themselves taking naps all the time. When it's starting to feel like a nuisance, then
Mhm.
you're going to want to see your doctor. If not, that exercise of doing the sleep that filling up your bank account that actually can help you.
Mhm.
And that I know it's kind of, it doesn't sound scientific, but it was in the presentation that Humana put together, and it actually is a method to help people kind of rejuvenate their sleep.
Yeah, and I think it's so important because Dr. Maria, correct me if I'm wrong, but I heard that if people don't get enough sleep, it becomes such a health problem. This can like maybe lower your life expectancy and maybe increase things like dementia and things like that down the road too as well, isn't it?
Definitely, definitely. It sounds like you've done a lot of research on your own, and you're completely right. You are at greater risk for chronic illnesses such as heart disease, diabetes, high blood pressure, dementia, strokes. A lot of chronic illnesses happen because sleep is a time when your body's cells regenerate. They become like new again. And so every time you get that, the number of hours of sleep that your body needs for the evening, it's almost like you're a brand new person. And when you get a good night's sleep, don't you feel like a brand new person?
Yeah, it makes such a difference. And, I was talking to you before about my former life as a reporter, morning reporter, where I would wake up at 4, 3, 4 in the morning and be so tired because I never get enough sleep. And I felt like I was getting sick more often, like just getting the cold or the flu or something like that. And I feel like now that I'm sleeping normal and I don't wake up with an alarm clock anymore and just waking up when my body wakes up, knock on wood, I feel like I'm a lot healthier. And I think there's a correlation there, right?
Correct, correct. And there are, a lot of supplements out there, melatonin maybe being one of them, different kinds of herbs. Please check with your doctor before trying them out. Don't just go to the pharmacy, pick up a bottle, and then, try to follow the directions of the bottle. Make sure you see your healthcare professional before starting on any kind of, treatment program for your sleep.
Yeah, good advice. And finally, we just want to end on it. You said, okay, so what are some of the natural ways? What are your best tips for getting good sleep? What works for you?
Well, like I said, before I found out about the sleep bank,
Mhm.
I was not getting a lot of sleep, and then I finally just gave myself permission to kind of let go for that 24 hours or that 2 days that I needed, and
Mhm.
it's done wonders for me. So really, personally, the sleep bank in my own family, I don't allow televisions in any of our sleeping bedrooms.
Mhm.
The television sets are only for, where we gather as a family, the living room. Some offices have them, but otherwise, the tip about electronics, really minimizing electronics, is a very, very good one to follow in terms of trying to get enough sleep. And phones, don't be on your phone until 12 midnight. You'll never get any
I
sleep.
know, I know it's hard, because I always have that phone right when I go to bed and when I wake up. So I know it's harder. It's easier said than done, but I'm going to try. I'm going to try not to do it so close to bed. But Dr. Maria Urbiztondo, thank you so much for sharing some great information with us today in honor of National Sleep Awareness Week. We know sleep is so important, and we thank you for coming and talk to us, and we hope to see you next time. Thank you, Dr. Maria. And thank you, everybody, for watching us today on Family in Focus. And we'll be seeing you next week on our next episode. Have a great day.